Presenting the case of PB, an 18-year-old male who comes to my urgent care clinic for the first time because of a sore throat of 1 week duration. He was in good health up until a week ago. Claims the throat pain started 7 nights ago, is mostly at the back of his throat, on both sides, does not radiate, with a pain score of about 7 to 8 out of 10 in pain severity. He described the pain as burning in character, persistent, and constantly present. He couldn't recall anything that precipitated it. When asked what makes it better or worse, he says that swallowing aggravates the sore throat, and sipping cold drinks would slightly relieve it. 3 days prior to this visit, he suddenly woke up, aside from the sore throat, with a really hoarse voice. He also noticed some malaise and generalized fatigue. He has not tried any medications for this. 2 days prior to consult, he noticed he developed some lumps at the back of his neck on both sides, and he points to this area. Says it's really hurting now to eat solid foods and swallow, but he still tolerates liquids. 1 day prior to consult, he developed generalized mild abdominal pain. He described it as constant and achy in character, and he says, quote unquote, "It hurts under my ribs every time I do some twisting movement during hockey practice." He denies any constipation or any diarrhea. When asked whether there were any sick contacts that he came across with, he said that he has this new girlfriend of 3 months, and his girlfriend also had a similar sore throat for about 2 weeks during the past month. PB thinks his condition is getting worse, that's why he sought consult. Pertinent associated positive symptoms on review of systems include fever and chills, malaise and fatigue, loss of appetite and nausea associated with mild generalized abdominal pain, as well as noticing some lumps at the back of his neck and some voice hoarseness. Pertinent negatives include no cough, no colds, no postnasal drip, no eye itchiness or discomfort, no ear symptoms like discharge or pain or any hearing loss, no shortness of breath, no stridor, no headache, no muscle aches, no unintentional weight loss, no night sweats, no drooling, no vomiting, no trismus or lockjaw. There was no diarrhea or constipation, and no rash. The patient does not have any allergies. He does not take any medications. His past medical and surgical history are unremarkable. He has not had any previous hospitalizations. Family history: his father has hypertension and diabetes for 5 years. His mother has hypertension for 8 years. Other than that, nothing else. His immunization history is up to date. His personal and social history: he's a sophomore at the University of Manitoba taking up engineering. He lives in a dorm inside campus with no pets. He is also a member of the collegiate hockey team. He has a new girlfriend of about 3 months that he met at the university, who lives also in a co-ed dorm in campus. He does not smoke. He denies use of any illicit drugs. He occasionally has 1 to 2 beers over the weekend. He exercises daily, attending strenuous hockey practice Monday, Wednesday, Friday for about 2 hours, and cardio training Tuesdays, Thursdays, and Saturdays for about an hour. He is a sexually active man with his new girlfriend of 3 months. They usually engage in sex for about 3 to 4 times a week. They engage in oral, anal, as well as vaginal sex. He claims that he has had 8 sexual partners over the last year prior to this girlfriend, and he has always used protection in the form of condoms. On the focused physical exam, I'm going to mention only the relevant positive and the negative findings. So here comes an 18-year-old man who's alert and oriented to time, person, place, and event. He does not have any respiratory condition. He has easy unlabored breathing. He's not tripoding. He does not use any accessory muscles of respiration. Time and again, he would just touch massage his anterior neck, especially when he swallows. He speaks in fluent sentences. His posture is erect while he's sitting and talking to me. His vital signs are as follows: blood pressure is 124/78, heart rate is 92, RR is 20, O2 saturation is 99% on room air. He's slightly febrile with a temperature of 37.8 degrees centigrade oral, and his pain score is 7 out of 10 on the throat. As I said, his head, eyes, ears, and nose are essentially have normal findings. The throat, on the throat, his posterior pharynx is erythematous. I did not appreciate or see any postnatal drip or drainage. There's no lesions or no lumps, no edema or masses seen bilaterally on the posterior pharynx. The uvula is midline, it is swollen but not deviated, and it rises on phonation. On the soft palate, I appreciated some palatal petechiae on the posterior soft palate just anterior to the palatoglossal arch and the uvula. But there are no other lumps or lesions noted. His tonsils are symmetrically enlarged. They're erythematous and swollen. It's grade 3. There's no exudate seen on the tonsils. His TMJ doesn't have any redness or swelling. He is able to open his mouth with smooth range of motion, and there's no tenderness or clicking. On the neck, on inspection, it's symmetrical. The trachea is midline. There's no lesions. Auscultation of the neck, there's no carotid bruit. On palpation of the neck, it's supple. There's no neck stiffness, full range of motion. I can only appreciate on the cervical lymph palpation, cervical lymphadenopathy palpation, there are two soft, tender, and mobile lymph nodes on the left, just behind the sternocleidomastoid muscle, which measures roughly around 1.5 by 1 by 1 cm, length, width, and depth. And then there's a solitary, bigger lymph node on the right posterior neck, just behind the sternocleidomastoid muscle, which measures about 1.5 by 1.5 by 1 cm. Other than that, his chest and lungs are clear. Breath sounds to auscultation. His cardiovascular, he has good S1 and S2 heart sounds. There's no murmurs heard on all 5 cardiac listening areas, and there's no gallops heard on the mitral area. On abdominal examination, on inspection, it's flat. His abdomen is symmetric. There's no lesions or scars. On auscultation, the bowel sounds are normal, active on all 4 quadrants. There's no bruits on the aorta, renal, iliac, and femoral. However, I appreciated a friction rub over the splenic area on the left costal margin. On percussion, he has tympanic sounds on the 4 abdominal quadrants. The liver span by percussion on the right is 9 cms. There's positive dullness to percussion on the last interspace of the left costal margin on the left anterior axillary line when the patient inhaled deeply. On palpation, there's positive tenderness even on light palpation on the splenic area over the left costal margin, but no tenderness on palpation over the right costal margin. Both kidneys are non-palpable. CVA tenderness is negative. There's no peritoneal signs like McBurney's, rebound tenderness, Rob Singh's obturator, and psoas are all negative. Murphy's sign is negative. The integumentary system is warm and dry. There's no rashes and no erythema or no bruising. In summary, I have an 18-year-old male who comes in with a sore throat of 1 week duration. This was associated with some generalized malaise and fatigue. He also had some posterior cervical lymphadenopathy, and unremarkable ample and family history, but he had a positive sexual history with his girlfriend having had the same symptoms about a month ago for 2 weeks. Pertinent PE findings, for the most part, his head, eyes, ears, nose, and sinuses, as well as respiratory, cardiac, and integumentary were all normal. The only positive abnormal findings centered on the throat and the abdomen, and they are as follows. Number 1, an erythematous posterior pharynx without any lumps, abscess, or drainage. An edematous uvula, but non-deviated, which rises on phonation. Number 3, palatal petechia on the posterior soft palate. His palatine tonsils were bilaterally enlarged and swollen, but no exudates and no lumps or abscesses seen on the palatine arch. There's posterior cervical lymphadenopathy on both sides of the neck. On the abdominal findings, I appreciated a positive friction rub on the splenic area, and his percussion test for splenomegaly turned out positive, and he had tenderness to palpation, even to light palpation on the splenic area. That concludes my presentation.